Giselle, Anne Margaret, Sandeep, Navjeet, Etienne, the members of Family Group 9 presents The Miller Family.
Family story. Next. The Miller is a nuclear family composed of a father, a mother, a son, and a daughter who lives in Toronto, Ontario, Canada. Mark Miller, the father, 40 years old and the head of the family, who works as a construction worker and has been a cigarette smoker and alcoholic for 10 years with a history of high blood pressure. Jan Miller is 36-year-old, the mother who works as a customer's representative job from home. She has no medical history. She is the caregiver in the family. Jacob Miller, the son, 8 years old, diagnosed with level 1 autism, needs special care and currently on behavior therapy. Mary Miller is the daughter, 6-year-old with normal mental and physical growth, attends senior kindergarten. Next. Case scenario. While at work, Mark Miller complained of severe headache, changes in his vision, difficulty in breathing, chest pain, and suddenly fainted. Therefore, one of his co-workers called 911 and was taken to the hospital. After the initial lab results and diagnostic test, CT MRI of the brain, was diagnosed with hemorrhagic stroke, had to operate immediately. After the surgery, doctor said the brain's left side is affected, hence weakness on the right side is expected. Next. There could be complications after the surgery like dysphagia, loss of vision, hearing, impaired motor skills, pressure ulcer, memory loss. Next. Currently, Jen become the sole and primary provider and will be at the risk for depression and anxiety because has to do all activities like drop the kids to school, visit her husband. Moreover, she is worried about financial situation and the home environment is not healthy anymore. So kids feeling a change in their daily activities because of father's absence. After the discharge from the hospital, Mark also becomes dependent for all his activities on Jan like bathing, feeding, dressing, etc. Next. Family structure characteristics determinants. So family structure includes the household members like 2 male members, father Mark Miller 40 years old, son Jacob 8 years old, 2 female members, mother Jan Miller 36-year-old, daughter Mary 6 years old. Next. They are Canadian and living in Toronto, Ontario. They are religious and following Roman Catholic. Social-economic status under the middle-class family. Lives in a safe and functional environment with positive and healthy family relationship. Next. Current health status and health problems. Mark Miller diagnosed with hemorrhagic stroke. Jan Miller and Mary Miller no health history. Jacob Miller diagnosed with level 1 autism. Focus of care. Mark Miller for post-op care and rehabilitation. Jacob Miller for behavior therapy and they are the recipient of care. Next. Impacts of determinants on health patterns and practices. So Mark Miller living in the city means accessible to all facilities like public transport, schools, social services, living in a safe and healthy environment free from all type of discrimination, racism, build up the healthy relationship with neighborhood, kids are also happy, have good friends, seems satisfied.
Development of the health problem. Hemorrhagic stroke. The risk factors are uncontrolled hypertension, cigarette smoking, alcohol and drug abuse, exposure to air pollution, low levels of exercise, lack of sleep, and stress. Hemorrhagic stroke. Impact of the health problem on the entire family. Their schedule and timing will change. There is a financial burden, potential problems with mom's job. There's a limited support system and possible mentally disturbed, stress, and anxiety. Hemorrhagic stroke development and expression of the problem. Financial difficulty, time management, development of other health problems, increased conflict within family members, school problems, poor or decreased job performance of the mother. Clinical reasoning. When did the illness enter the family's lives? Jacob was presenting signs of autism and was diagnosed after a couple of screening done. And Mark had modifiable risk factors of stroke and was diagnosed of hemorrhagic stroke 3 days ago. What did the family do? Before the illness, Miller family was just like any traditional family with parents having their normal jobs and kids going to school on weekdays. And the Miller family loves spending time together during the weekends. How do they react? Family members were shocked. The wife was overwhelmed with the situation, thinking how she can handle all things by herself, although the children thought their father is only recuperating in the hospital from minor illness. How do they seek help? The nurse referred them to social worker, a rehabilitation center, and support volunteer groups. The community health nurse follows up with Mark's rehab schedule and appointments. Physiotherapists and occupational therapists are also available and regularly visit Mark for some rehab sessions, and both the in-laws are readily available for the family. How does the illness influence their routine? The illness brought huge changes in the family's lifestyle. Jen, as a primary caregiver, spends most of her time taking care of Mark. Her in-laws offered some help in taking care of the kids. How does the illness influence their ability to carry out their responsibilities, their job, their education, their social activities, their relationship, their family responsibilities, or their community responsibilities? Mark is not able to go to work and has limited social activities during this time. He is mainly dependent on his wife. Jen is less focused on her job, and there was a noticeable weight loss and anxiety from her, and the children were also became less interested in studies and less socializing as well. How does the illness influence their sense of meaning in life? Mark experienced total depression. He feels less of a man as he can't provide for his family anymore. The wife, Jen, feels stressed out as she's got lots on her plate and yet remains strong. Nevertheless, the religion as Roman Catholics made their faith and relationship with God grows even more stronger with the current situation. What changes does the family need to make to their lifestyle? First, they have to accept the changes brought by the sudden change in their health condition of their father, and financial management at this point is essential, and the mom would eventually need to find additional source of income, perhaps a second job to provide for their family. Scholarly articles related to family story. According to Article 1, chronic disease has a huge impact in the relationship, social life, financial aspects, and activities of the family. Its focus is mainly on the effect of stroke on family careers and family relationships. Due to the stroke, Mark lost his job and gets frustrated, thinking that he's giving his wife a huge burden as she took over all the responsibilities. In addition, Mark Miller suffers dissatisfaction in his career life, functional disabilities, and physical impairment. Jen, on the other hand, is risk for developing depression and anxiety. Article 1 also mentioned that the greatest challenges to the family of a post-stroke client are problems with cognition, behavior, and communication. Article 2. The clinical implications of family-centered care in stroke rehabilitation. The Article 2 focused mainly on the implications of family-centered care in stroke rehabilitation. As per the article, once stroke survivors are discharged home, family members provide majority of the care, therefore family care providers should be included in the treatment planning. Article 3. The impact of this is on family members, a critical aspect of medical care. According to Article 3, correlating it to our family story, Mark's self-esteem, confidence, and well-being were deeply affected because of the stroke. The wife, Jen, was also in psychological grief, feeling of helplessness and out of control. The Article 3 also mentioned financial costs for the family as one of the biggest burden in addition to the mental, financial, and family relationship, as well as education, employment, leisure activity, and social practices.
ECOMAP. Next. The family is composed of a strong relationship with social worker, hospital, Mark's weak relationship, its financial status, school for special needs, church, and religion friends. Genogram. The family is composed of a mom, a dad, and 2 children. Next. Therapeutic questions and commendations. The manners that are used during an interview is to greet each family member politely, ask open-ended questions to encourage interaction, be an active listener, show proper gesture when talking to the family, display professionalism when meeting with the family. And then the therapeutic questions are: what are the potential problems you are facing with this illness? What changes or adjustment does this illness bring to your family life? How did your family try to cope with this situation? What do you consider the strength and weakness of the family? Next, still on the therapeutic questions, what are the current support and resources available for the family? What other information would you like to know about to support the system? What are the concerns for the future? Psychosocial consideration. The coping ability of family with the current situation, level of knowledge of stroke and its treatment, physical and mental health, and social support system. Difficulties and challenges. We'll ask our caregiver stress, time constraints, limited social support, financial constraints, possible disrupted social interaction at work, possible disrupted social interaction in school.
Commendations of family and individual strengths. Mark Miller was working hard to raise his family, a very loving and supportive father and husband who shows affection to his wife and children. He cooperates and participates well with his physiotherapy and speech therapies. Jan Miller is a strong and caring mother who took care of her children while her husband is in the hospital. She's stressed out but still fulfills her duties and responsibilities, balancing the family's prior and added roles. She shows power and resilience as a woman, wife, and mother, tackling the obstacles thrown at her. Jacob Miller is a nice and loving son and brother. He doesn't have many changes in his daily routine. Jacob is understanding of his family's current situation. He tries to do well in his studies. Mary Miller is an obedient, loving daughter that shows affection and care to her family. She always tries to help her mother and do things as independently as possible with minimal help. Mary is doing well in her studies. The Miller family is coping, cooperating, and adjusting well with the situation. They're trying their best to manage the situation properly. As a group, this is how we will communicate with the family. Hi, Mr. Miller, you possess a good character. You are a very hardworking and a responsible father. No matter what the situation is, don't feel bad. Just keep focusing on your rehabilitation towards your complete recovery. Rehabilitation care centers, physiotherapists, and support groups are always there, ready to help you. Hi, Jan Miller. We realize that you have a strong character. You are going through rough times, but still, you're determined and optimistic, making the situation bearable. You held up your family pretty well, and we commend you for that. Continue focusing on your family's well-being, as you are the only person they can rely on. Stay healthy with this positive attitude. Your family also have a strong faith in God, making everything one step better. Hi, Jacob. We know that you are trying your best in your studies. Learning to be independent is such a good thing, and I'm sure you will make your parents proud. You are a good role model to your sister. Mary Miller, you are a loving daughter. You are doing a great job in helping your mother, behaving well, and will make your parents happy and proud. Please continue your good behavior. Thank you for being a supportive family member. To the whole family, we are proud of you and your kids. You are taking care of each other in these challenging times. The optimism and strength that you show bring positivity in the situation. Mr. Miller will recover soon completely. Family Care Plan. According to the Family Assessment and Intervention Model, families are subject to tensions and stress. The Miller family is experiencing stress due to Mark's medical condition that significantly affected their daily activities. This model focuses on health promotion, wellness activities, and problem identification, family directions at lines of defense and resistance, and restoration of stability and functioning. The second tool is the Family System Stress to Strength Inventory to identify stressful situations, and it supports the Family Assessment and Intervention Model. It tackles general and specific stressors and focuses on family strengths. The stressors experienced by the Miller family will be assessed using this tool. Further, this tool actively involves the family in decision making.
Our nursing priorities for this family. Mr. Miller's physical mobility, nursing assessment. Mr. Miller has a right-sided weakness, decreased muscle strength, and limited range of motion. He has difficulty performing activities of daily living such as toileting, dressing, and eating. Diagnosis: impaired physical mobility related to weakness on the right side, decreased muscle strength, and limited range of motion. Objectives are: Mr. Miller will demonstrate increased strength and ability to move. Mr. Miller will be able to use adaptive equipment to increase mobility. Nursing interventions. Collaborate with the physiotherapist, occupational therapist, and recreational therapist in developing exercise programs. Encourage Mr. Miller to practice range of motion exercises to promote the patient's sense of control. Our second nursing priority is Mr. Miller's verbal communication ability. Assessment is Mr. Miller has difficulty in enunciating words. Mr. Miller is using sign language when he needs something. Nursing diagnosis is impaired verbal communication related to aphasia. Objectives are Mr. Miller will be able to use effective oral and written communication techniques. Mr. Miller will be able to explore some non-verbal communication techniques. Nursing interventions. Nurses should assess communication deficits. Nurses should use simple words and teach the family to use verbal prompts to Mr. Miller to express himself. Teach the family to provide positive reinforcement to Mr. Miller. Listen attentively to Mr. Miller to show importance to his thoughts. Next priority is possible impact of caregiving role of Mrs. Miller. Assessment is Mrs. Miller became the primary provider and caregiver of the family. Mrs. Miller is at risk of stress and anxiety due to change of roles in the family. She has additional responsibilities of caregiving. Diagnosis is risk for caregiver roles range related to significant changes in the family roles. Objectives are Mrs. Miller will be able to communicate her understanding and demonstrate the caregiving actions needed for her husband and children. Interventions. Determine Mrs. Miller's understanding of the current situation. Encourage involvement of all family members. Provide positive feedback to Mrs. Miller. Share stress reducing techniques. Tell Mrs. Miller to set time for herself. It will be good for her physical and emotional well-being. Nursing interventions need to implement at this time. Providing healthy education. Providing health education on disease condition, its risk and complication will give the family a better understanding, and providing sufficient information regarding Mrs. Miller's medication, exercise, and other family interventions. Next is family access to resources in the community. Mrs. Miller family faced numerous problems and stress, especially Mrs. Miller, and need support system and rehabilitation teams such as physiotherapist, occupational therapist, speech language therapist. Next is family therapy or counseling. Family therapy or counseling provides an opportunity to identify and discuss issues in the family. In the Miller family case, family therapy and counseling will promote open communication, identify and develop strategies, and coping and addressing the issues. Next is continuous home visitation and follow-up. Continuous home visitation and follow-up helps to encourage the family to implement the planned interventions. From the family group 9, thank you all for watching. If you have any questions, please type it on the comment section. Thank you so much.